Major rises in COVID-19 cases across the metro. Here's a look at the weekly case rate in Kansas City, Missouri. When this number goes up, it means the spread of the virus is increasing. And it's not just up here, it's way up. Just last week, KC saw almost 1,300 new cases. We talked to Kansas City's mayor this morning.
I've heard a lot of Kansas Cityans so far who said, we're going to rethink our Thanksgiving. We're not doing the same big family dinner. And I know that is a very tough decision, but I think it's a necessary one right now.
And after coming on our newscast earlier today, the mayor was on TV across the country. He went on CNN to talk about the rising cases in the metro.
I think it's fair to say many of us, however, opened up too quickly. We are dealing with the repercussions of that now. High death rates, infections, etc., that have created more concerns in this area, and the things that continue to get worse as the weather has gotten colder, as people are inside more, and as certainly we're getting closer to the Thanksgiving holiday.
The mayor says there are added difficulties for areas like Kansas City, where surrounding counties and states have different approaches to handling the spread. Now, coronavirus cases are just as bad on the other side of the state line. In Kansas, here's a look at Johnson County's current COVID-19 report. You can see the jump here. Again, here spiking on the right side of your screen, more than 16% now positivity rate. In the past week, the county has seen more than 2,500 new cases. Now, KCTV5 stands for you to bring you the latest critical updates. Today, local health experts shared an important timeline on a vaccine for everyone. As our Amy Anderson explains, it may be sooner than you think.
After months of waiting, a vaccine is closer than ever, but health experts say it'll likely be springtime before it's available for the general public, so we all need to buckle in for winter.
It's next spring before widespread immunization of the general public is even really a viable option, and that means that we're in for a winter.
If ever there was a time to work like we're on the same team, this is it. That's the message from doctors at the University of Kansas Health System today. 2 vaccines are about to roll out. Both require 2 doses, but it'll be spring before most of us get one. Here's how it'll work. The first round of what they believe will be an annual vaccine will go to healthcare workers on the front lines of the fight against COVID. These are the doctors, nurses, and other hospital workers who spend their days caring for patients that have the virus. Next will be long-term care and assisted living patients, then essential workers, and then the general public. As for the vaccines, they're new, and that brings feelings of doubt or even fear for some. Dr. Lee Norman with the Kansas Department of Health and Environment says while the medical professionals have been great at explaining the science side of things, they need to take more time to address what he calls the social psychology of it to try and help calm fears.
If you're a vaccine hesitant individual, it may not be the science that is going to convince you. I think it's human to human conversation.
More than anything, they stress unsafe vaccinations simply are not given in this country. And they say if you're hesitant, have a heart-to-heart about your fears with your doctor. As for those of you who have already had a confirmed case of COVID, doctors warn your immunity likely only lasts for about 3 months. So stay vigilant about wearing your mask and keeping your distance in public. In Overland Park, Kansas, Amy Anderson, KCTV5 News.